Hi, I'm Greg Danowski. I'm a physician assistant. I work here at the Manila clinic. Today I'm going to talk to you about diabetes. November is Diabetes Awareness Month. So diabetes is a disease that affects 34 million Americans. It's the 7th leading cause of death here in the U.S. What is diabetes? What kind of disease is it? So it's a disease where your blood glucose it kind of loses its effectiveness. Your body is less able to use that to get that to your tissues, and over time that causes damage to your organs. It can lead to all sorts of bad things. It can lead to things like heart attacks and strokes. It can cause kidney failure. It can cause nerve damage, blindness, so all sorts of bad things. A pretty common question is, well, how do I know if I have diabetes? What are the symptoms that I should look out for? And unfortunately, diabetes is typically asymptomatic. People can go years with diabetes diagnosis that they don't know about until things get pretty severe. So that's why we recommend that everyone come in and get screened for diabetes. It's something that you can diagnose with a simple blood test that we do here in our clinic. And anyone kind of from the age of 35 and up should get that screening done. And it's something that you should do on an annual basis. If you got a diabetes check when you were 35 and it was negative, you could still come back when you're 45 and have it be positive. So it's something that it's important to stay up on. Another kind of typical question is, well, what are the risk factors for diabetes? So, the two kind of main ones that I think about are, one is genetic inheritability. So if you have parents that have diabetes, if you have siblings that have diabetes, that increases your risk of having diabetes by 5 to 10-fold increase. So you're at a much higher risk of getting that diagnosis. The other predominant risk factor for diabetes is obesity. If you're overweight, then your chances of getting diagnosed with diabetes is much higher. Another common question is, how does diabetes get treated? And so really diabetes, there's lots of great medication out there. It's really not a complex illness to treat, provided that you get that diagnosis as early as possible. So really kind of the take-home message today is just to come in and as part of your annual wellness visit, be sure to ask about diabetes screening and get that done. And then, that'll help you out in the long run.